Oftentimes, speech-language pathologists and other specialists suggest that the student be placed in the front of the classroom so that they can benefit maximally from the instruction. But when you walk into the classroom and you observe, what you may see is that the teacher is roaming around. So the student sitting in the front of the classroom does no good. Or that the teacher is teaching from the left-hand side of the room because that's where the whiteboard is. Or because she needs to attend to the needs or the behavior of another student, she may move her teaching to the right-hand side of the classroom. So all of a sudden, that recommendation that was made that the student be placed in the front of the classroom in order to benefit his learning doesn't make a difference. If you reduce sarcasm and humor and puns for children who have specific learning disabilities, they're likely to be able to understand the underlying message. So that's how this works. So let's now take a look at what the modification strategies start to look like. At this point, it's time to identify those 1 or 2 strategies that teachers can embed into their teaching to help improve the overall performance of students in their class. You'll want to pull out the handout entitled Recommended Strategies for Modifying Instructional Communication. And what you'll notice is that there are a list of communication strategies that teachers or others can use while interacting with students. And based on all of these observations that we've done and formal and informal assessment procedures, as well as the conversations that we've had, it starts to become very clear that there are a few key areas that we can advise teachers to adapt for their classroom and for their communication.